Hi, I'm Dr. Shaina at HealthFit. Today I wanted to talk about one of the common presentations that I see come in the clinic. It's talking a little bit less about pain per se, pain can present, but more a little bit about sensing imbalance or feeling like something's off side to side. So for example, if you squat, do you feel yourself shifting to the right, or do you see it in the mirror when you're in your classes? Or does your teacher and instructor kind of cue you that you're shifting your pelvis to one side when you get down to that bottom of the squat? Or even if you're powerlifting, do you find that you kind of sit down into one hip and you can't quite lift it up evenly or push off both legs evenly? Another thing would be, do you sense that you're a little bit off balance on maybe the right side and you feel like you're rolling into that arch, and then left side you're kind of up and vaulted a little bit more? Also, you can look at hip rotation. Have you noticed that one side you can cross your leg pretty easily compared to the other? Like maybe your right side would not be able to rotate quite as far as the left side this way, or the left side you might not be able to swing as far as you can on the other side. These are different versions of, well, I have legs on both sides, they're ball and socket joints and hip joints on both sides, but they just don't feel even, and I'm doing all this stretching and doing all this strengthening and it just doesn't seem to even out in some way. What more could there be? One of the approaches might be to look at pelvic positioning. If your pelvic bones are not positioned in neutral, then that's going to position your hip not in neutral as well. So one hip might be a little bit more rotated outwards than the other. So when you're starting in this kind of relative neutral position, you may not be neutral to start with, which is why it makes that arc a little bit different. Might be less this way and more this way, and then more this way and less this way. One of the ways that we can address it is through a Postural Restoration Institute technique. I'm going to show you one out of many, but this is just the beginning, and this is kind of just one treatment approach that we can work on. It's called the 90-90 hip lift with hip shift. Okay, so looking at the 90-90 hip lift with hip shift, why we're talking about that pelvic repositioning is if your pelvis is not in neutral. Neutral is a place that you want to be able to get to. You don't have to hold neutral all the time, but we are walking people. We're walking one way and then the other way. Your pelvis should be able to reciprocate side to side. We're not designed symmetrically. You have a dome diaphragm more on one side than the other, and then you have this heart on one side and the liver on one side. So how is it going to be that symmetric? It's okay to be asymmetrical, but you need to be able to transition through neutral to get from side to side, so you can get to one leg and onto the other leg as well. Okay, so for the 90-90 hip lift with hip shift, you go onto the floor with your hips and knees at 90 degrees and feet on the wall. The wall is kind of simulating your floor, because this is essentially to try to get you to be able to stand and be on your feet and find that neutral. So you have a 4 to 6 inch squishy ball between your knees. You take a deep breath in first, because the diaphragm is a big part of this. Inhale. Exhale, reach those knees towards the ceiling, which curls your pelvis under with the low back on the floor and tailbone curls up. You don't want excessive contraction of your abdominals here. You want it to be nice and light without a lot of six-pack work through here. Then you squeeze the ball, feeling the inner thighs working, and drag both heels down, feeling the hamstrings working. So I have an isometric contraction of my inner thighs and my hamstrings. I have this nice posterior pelvic tilt in my pelvis through here, and I'm gonna breathe in again. And as I exhale, I'm going to shift my right knee forward and right hip forward and pull my left knee and left hip back, maintaining that pelvic tilt. I don't want to shift side to side. I'm pretending I'm between two walls and I'm shifting forward and back. Then squeeze that left knee in and drag that left heel down. You're going to feel a lot of work in that left inner thigh and left hamstring. While holding that, you're going to march that right leg up and down 10 times, maintaining that hip shift. And then resting. You would do that 3 times, 10 marches. But it's so important to sense your body, sense where your body's in space, sense what muscles you're recruiting, and sense how you're breathing and how you're moving your body. If you can't sense your body, how would you be able to correct what you're doing in the first place? How would you be able to shift how you're doing something to make that skill more accurate? So that sense is so important and key to empowering you to do a little bit more and self-correct and be a little bit more independent in controlling your own movement and body. So that is just the beginning of it all. So you want to be able to get to neutral, but then outside of that, then you want to be able to recruit different muscles that you might not be able to recruit very well if you're stuck in different muscle patterns, so that you can get from side to side, so that you can shift evenly side to side. And when you're doing strengthening exercises and stretching, you're actually stretching what you're trying to target or strengthening what you're trying to target without compensation. I hope this was helpful. If you have any other questions, please don't hesitate to give us a call. You can come and chat with us and we can see exactly what you need for yourself and how you present.